Deaths in the city now top 1,500, with confirmed cases nearing 50,000, prompting a new recommendation to all 8.5 million New Yorkers: cover your face in public. The mayor warned today the new guidelines do not replace social distancing, though. But now, along with maintaining 6 feet, everyone is asked to shield their face with some sort of protective covering, Stefan.
That request coming on the heels, Natalie, of a dire warning from the governor saying the state is on track to run out of ventilators in just 6 days. City hospitals already anticipate needing as many as 3,000 more by next week and 15,000 more overall. They'll be using facilities across all 5 boroughs, including the Javits Center on the west side, where News 4's Ray Vieta kicks off our live team coverage tonight. Ray.
Hey, Stefan. Tonight, the city is in a race against time. The governor says there are only enough ventilators to last hospitals days. The Javits Center behind me is now taking COVID patients, and the mayor is now recommending New Yorkers wear some sort of face covering when they're out in public. New York City struggling to keep up with the calls for help. The number of cases of deaths continuing to rise. Hoping to stem the tide, the mayor issuing a stunning recommendation.
We're advising New Yorkers to wear a face covering when you go outside and will be near other people.
A face covering like a scarf or bandana to protect others from getting the contagious virus.
The reason for this guidance is because the studies are showing that some asymptomatic people, some pre-symptomatic people appear to actually be transmitting this disease.
With more than 50,000 cases of COVID-19 in New York City, life-saving supplies are running out.
We have about 6 days of ventilators in our stockpile.
Hospital space is too. The Regional Emergency Services Council now directing first responders not to bring cardiac arrest patients into emergency rooms. If a victim doesn't respond to CPR and other treatments, they'll be pronounced dead on the scene.
Our mission is to bring back life. And this is going to have a major impact on our workforce.
The Javits Center will now start taking COVID-19 patients, and some city hospitals will triple ICU capacities. Among them, Bellevue, Lincoln, and hard-hit Elmhurst Hospital. The city also needing staff to tend to those beds.
Even with the equipment, you always need the personnel. All these doctors and nurses and extraordinary healthcare workers, we need more and more help.
In a city overcome by a virus, signs of hope, of solidarity. Gratitude for those risking their own lives to save others.
We are in a crisis, and we are in a crisis together as a city, and we need everybody's cooperation in order to beat this. I've seen New York stand together in the past, and this is that time where we need it to happen again.
New Yorkers are coming together. Now, the mayor is recommending folks use some sort of bandana or some sort of piece of clothing because he wants to reserve those masks for healthcare workers, and he also is reminding folks to still maintain your social distance despite wearing a face covering. We're live on the west side tonight. I'm Ray Vieta, News 4 New York.
New Yorkers being safe and standing strong. Ray, thank you so much. And thanks to data just released by the City Department of Health, we're now mapping the cases in New York City by zip code. To find the number of tests taken and the cases confirmed in your neighborhood, just go to our website, NBCNewYork.com/virusmap.
As local doctors and nurses continue to desperately plead for more protective gear, President Trump says that millions of pieces of medical equipment have already been sent to New York. Tonight, the president said the city and state received millions of face masks and gloves, plus thousands of ventilators and face shields. Senate Minority Leader Chuck Schumer is calling the Trump administration's response tardy, uncoordinated, and inadequate. Just a few hours ago, Schumer called for the appointment of a senior military officer to coordinate the production and distribution of medical equipment.
The Defense Production Act would allow the president to appoint a leading military figure who knows logistics, who knows quartermastering, who knows command and control, to take charge without politics and get the materials we need to the places they're needed most.
In response, the president fired off a letter to Schumer saying in part, quote, if you spent less time on your ridiculous impeachment hoax, New York would not have been so completely unprepared for the invisible enemy. Well, tonight, for the first time, we are getting a look at the stockpile of medical supplies the feds say a Brooklyn man was hoarding and selling on the black market. Photos showing these boxes of PPEs confiscated by the FBI and DOJ. The bus followed a report that you saw first on 4. Authorities ended up tracking down Baruch Feldheim after they say he sold supplies to a New Jersey doctor at, get this, a 700% markup. Now he faces 6 years in prison. Those supplies will go to local hospitals.
Natalie, another horrible milestone today marked the deadliest day New Jersey has seen since the start of the pandemic. The toll jumping to more than 500, a 34% spike since last night, and now the number of confirmed cases in the state tops 25,000. Crews are rushing to build 4 field hospitals in New Jersey, including 250 beds at this facility at the Meadowlands. That's our News 4's Checky Beckford joins us live tonight to continue our team coverage. Checky.
Stephan, field hospitals like this one should matter to everyone in New Jersey because it's not people who have COVID-19 who will be sent here, but anyone who needs a hospital bed and can't get one during the peak of the pandemic. Everyone agrees that more hospital beds are needed. What they don't agree on, though, are face masks. The face mask debate rages on even among New Jersey leaders.
If we flipped the switch and said, general public, you need to wear masks, we don't have the masks.
In New Jersey's largest city, Mayor Ras Baraka apparently telling residents to cover up.
When I finish this call, I'm going to make another edict about Newark and covering your face and mouth when you go outside.
But Baraka, whose city has nearly 800 cases and 21 deaths, acknowledges the shortage and difficulty in getting masks.
What happens is all these private companies begin making masks and competing and charging prices that are ridiculous.
Many in New Jersey already buying masks and gloves. Used ones turned litter tossed in parking lots across the state. Meanwhile, state officials focused on getting as many medical supplies as possible, giving the state police authority to take private medical supplies and equipment, some of it to fill field hospitals like this one at Meadowlands Expo Center.
The pressure on our hospital systems building.
The 250-bed pop-up being built using materials from the national stockpile will house non-COVID-19 patients.
She was a front-line hero.
The governor remembering some of those lost to COVID-19, like healthcare worker Kim King-Smith.
Her family is saying her smile was, and I quote her family, more infectious than the virus that took her life.
And the governor also noting the names of several others taken by COVID-19, including a Hudson County officer. Now, the CDC is said to be weighing whether or not to advise Americans to wear face masks, not only face masks, but cloth face masks when going outside. Live in Secaucus, Checky Beckford, News 4 New York.
Checky, thank you very much. Now to Connecticut, where they confirmed 267 new cases of coronavirus today. That brings the state total to more than 3,800 cases. Health officials reporting 112 deaths statewide. That includes a 7-week-old baby from Hartford, Connecticut.